Here's a comprehensive overview of diazepam injection. Introduction. Diazepam is a benzodiazepine medication widely used for its sedative, anxiolytic, anticonvulsant, and muscle relaxant properties. It works by enhancing the activity of gamma-aminobutyric acid, GABA, a neurotransmitter that inhibits activity in the central nervous system, CNS. The injectable form of diazepam is primarily used in acute settings where rapid onset of action is required. Pharmacological profile. Mechanism of action. Diazepam enhances GABAergic activity by binding to the benzodiazepine site on GABA-A receptors. This binding increases the frequency of chloride channel opening, leading to hyperpolarization of neurons and reduced neuronal excitability. Pharmacokinetics. Absorption, rapid onset following intravenous, 4, administration, slower with intramuscular, IM, injection. Distribution, highly lipid-soluble, crosses the blood-brain barrier quickly. Metabolism, metabolized in the liver by cytochrome P450 enzymes, CYP2C19 and CYP3A4. Elimination half-life, 20 to 50 hours, longer in elderly and those with liver dysfunction. Excretion, excreted via urine, primarily as metabolites. Indications for diazepam injection. Diazepam injection is indicated for several acute and emergent conditions, including 1. Status epilepticus. First-line treatment to terminate prolonged seizures or repetitive seizures without recovery between episodes. Rapid 4 administration is preferred for its quick action. 2. Severe anxiety and agitation. Used in acute situations where oral administration is not feasible. 3. Muscle spasms and spasticity. Effective in relieving severe muscle spasms, particularly due to tetanus or neurological disorders. 4. Alcohol withdrawal syndrome. Helps manage severe symptoms like seizures, agitation, and delirium tremens. 5. Sedation for medical procedures. Used as a premedication to induce sedation and amnesia before diagnostic or surgical procedures. 6. Adjunct in anesthesia. Administered as part of balanced anesthesia for its sedative and anxiolytic effects. Administration routes. 1. Intravenous, 4. Preferred for emergencies like status epilepticus. Provides rapid onset of action, 1 to 5 minutes. Should be administered slowly to avoid respiratory depression and hypertension. 2. Intramuscular, IM. Used when 4 access is unavailable. Slower onset compared to 4, 15 to 30 minutes. Absorption may be unpredictable, especially in critical conditions. Dosage and administration. Adults. Status epilepticus, 5 to 10 mg for every 10 to 15 minutes as needed, maximum 30 mg. Severe anxiety, 2 to 10 mg IM4, repeated every 3 to 4 hours if necessary. Muscle spasms, 5 to 10 mg 4 or IM initially, then 2 to 10 mg every 3 to 4 hours as needed. Premedication, 5 to 10 mg 4 prior to procedures. Pediatrics. Status epilepticus, 0.2 to 0.5 mg/kg for every 2 to 5 minutes, maximum 5 mg per dose or 10 mg total. Geriatrics. Reduced doses recommended due to increased sensitivity and slower metabolism. Contraindications. 1. Hypersensitivity to diazepam or benzodiazepines. 2. Severe respiratory depression. 3. Acute narrow-angle glaucoma. 4. Untreated severe hepatic insufficiency. 5. Myasthenia gravis. Precautions. 1. CNS depression. Use caution in patients with compromised respiratory or CNS function. Co-administration with other CNS depressants increases the risk of sedation and respiratory depression. 2. Dependence and withdrawal. Long-term use can lead to physical dependence and withdrawal symptoms upon abrupt cessation. 3. Liver and kidney dysfunction. Dose adjustments may be necessary in patients with hepatic or renal impairment. 4. Pregnancy and breastfeeding. Diazepam crosses the placenta and is excreted in breast milk. It should be avoided during pregnancy, category D, and lactation unless absolutely necessary. Adverse effects. Common adverse effects include